Hello. A very good afternoon, everyone. Thank you for joining us for this webinar today. My name is Zhihan, a research assistant from SSR. We have invited Associate Professor Feng Qiushi, Deputy Head of the NUS Department of Sociology and Anthropology, and Assistant Dean of Research at FASS, share a couple of studies on living arrangements and social support among older Singaporeans as part of the Singapore Chinese Health Study. We also have Dr. Art Maulot, Senior Research Fellow at the Center for Aging Research and Education in the Duke NUS Medical School to moderate this session. So before we begin, I'll first make a few announcements. We are streaming this webinar on Zoom and recording this session live on our SSR Facebook page. By participating in this Zoom webinar, you consent to our recording and for SSR to use this for publicity. The recording and research article related to the study will be shared with all registrants after the webinar in a follow-up email. You may access the slides via the webinar recording. So this is for Q&A later. You may post and vote for your questions via our Poll Everywhere link, which I will share in the chat now. When the Q&A session is open to the floor later, you may also use the Zoom raise hand function if you wish to turn on your camera and microphone to ask your questions directly after getting the cue from our moderator. However, we will not be taking questions from the Zoom chat and the Facebook comments section. As we have a limited amount of time for Q&A, we apologize if we are unable to address all questions. So this is from SSR, a gentle reminder that we have 2 upcoming 13-week mentoring programs that will be held concurrently from August to November this year. The research skills mentoring is useful if you have a small-scale research project you wish to conduct, while the implementation research mentoring is more suitable for those who are looking at program implementation, scaling up a program, and examining how programs work in real-world settings. Our mentoring programs provide both training workshops and mentoring guidance from our research fellows at SSR. So for implementation research, if the mentoring program is unsuitable for you, we also offer a 1-day workshop on the 3rd of August. Do look out for this workshop using the QR code, and note that registration closes soon on the 12th of July. So with that, I will now hand my time over to Prof. Feng for the presentation. Thank you.
Thank you so much, Zhihan. Let me share my screen now. Okay. Okay, let me see. Can you see it? Yeah. Okay, good. Thank you so much for the introduction. And this is really my great pleasure to join SSR seminar. Today, I'm going to share some recent studies using the Singapore data. And my presentation is about living arrangement and social support among older Singaporeans. As you know, living arrangement and social support are 2 major and basic aspects of social connectedness for older individuals. They are so important for many disciplines such as social work, gerontology, and sociology. And the basic reason is because living arrangement and social support are kind of modifiable in the later life. And therefore, people really would like to know what kind of living arrangement, social support are needed for the older people to have a better later life. And there are also 2 basic elements for the mainstream model, the aging in place or aging in right place. I think for all the older adults, how to arrange their living arrangement with whom they are living with, and how they are supposed to receive support from family or community very important issues for their later life. However, how living arrangement and social support are related to health and well-being at old ages is actually complicated. And the social support could be understood as a structural factor. And those structural factors sometimes may be affected by the health and well-being themselves. Namely, there is very strong reverse causality issues. And another issue is about culture. The West and the East have very different cultural preference about how older people should live as in their later life. And therefore, making the connections between living arrangement and social support with health quite complicated. I'm in today's presentation, I would really like to present some very concrete examples to illustrate how complicated it could be. I specifically would like to focus on two recent studies. One recent study is about a very interesting question, that is, older Singaporeans more likely to feel isolated if they live alone. This seems quite reasonable for common sense. But in our research, we do feel this is a very meaningful research question we should investigate further, because there's a lot of healthy and active solo livers in Singapore society. And also, living alone may not necessarily mean they will have poorer health. And this kind of commonsensical perception, we hope to use something to review what's really going on under this assumption. The second one, we want to see why shall social support be always assumed to be positively related to health among older people? This is not actually only applicable to older people. Even for young people, we usually assume if you have more friends, if you have a better social connection, better social capital, larger social network, usually people will be healthier. And that is to say, social support, social connection is positively related to health and well-being. But there is a hidden contradictory scenarios here. That is, we always expect that older people, if they don't have good health, they are supposed to receive better support. This kind of expectation is actually against the assumption that social support positively relates to health and well-being. How can we reconcile this? I think these two studies will help us to understand better about these two issues. Both issues are actually based on the very complicated relationship between living arrangement and social support at old age. Let me start to talk about the basic data where we have been used. We have been used this SCHS, the Singapore Chinese Health Study. This study actually started from 1993. It has been almost 30 years from now on. At the very beginning, this study focused on the majority of the middle-aged people. But with time passing by, the follow-up studies more and more capture older people until the most recent way, the follow-ups rate, the mean age of this cohort has reached to 73. years. So this is a very long and large survey on Singapore Chinese. And the PI is Professor Cohen Pei from AUS Medicine. We decided to cooperate together and to investigate some social issues in use of this data. And then by using this data, we find some very interesting patterns. First of all, I would like to introduce the issue of solo living. As we all know, families are becoming smaller and smaller, and this trend actually started as early as 1960s in the West. The rise of the so-called one-person household, OPH, is now becoming a major demographic trend across almost all the countries in the world. Currently, in many European countries, 1/3 of their total household will be from the one-person household. And by 2020, 4 out of the top 10 countries with the highest OPH numbers actually came from Asia. And that's why solo living become a major academic issue, receiving a lot of attentions. And for the young people, solo living probably may mean their lifestyle might be very different. For example, they may choose smaller car or smaller apartment. Their lifetime, after like getting off work, could be, going to bars rather than being with family members. But for older people, obviously, older people living alone has been a concern for many government. And the older people who live alone are often targeted by different public policies. And people think solo livers at older age are vulnerable and need special attention. In this regard, older women are particularly vulnerable because most of them are widowed due to the simple fact that older women usually live longer than their spouse. And in Singapore, between 2000 and 2015, the percentage of Singaporeans aged over 65 years and older who live alone actually increased from about 6.6% to about 8.9%. I believe today, the percentage should be even higher. And that's why this caused a lot of concerns, particularly after the COVID-19. People living alone probably be more likely to feel lonely, isolated, and be more likely to be socially excluded. And that's why we need to pay special attention on these people. However, social living is actually a structure. Structure definitely could be a risk factor, but it may not be deterministic. As a sociologist, structure matters, but agency also matters. If we only see structure, the story may not be complete. That is to say, living alone may be a factor of social disconnection or social isolation. But we cannot say that all the solo livers at older age, they are unhealthy, unhappy. There's something more there. What's more is we think what really matters is not about how people live, but it's about how people interact. It's not about who do you live with. Even though people live with many people, they could still feel lonely if they do not interact well. So that is to say, we cannot simply understand social living in a very shallow level. We need to dig in to see what's really going on. So we use the SCHS data, and in this data, we have a very good measurement. That is the Duke social support skill. This skill is quite easy to understand. It basically asks every participant about their social support. Like, do you receive social support from your spouse, from your children or grandchildren, from your parents, sibling, other relatives, relatives by marriage, neighbor, co-worker, religious friends, or general friends? So basically 10 questions will be asked to kind of see how people receive social support from different resources. And based on the answer, people will have some score for each of the questions. And a simple total, a sum will be made. For example, in this slide, you can see this person end up with a score of 55. So using this social support skill, we could effectively identify people who are not receiving any social support. And that means they are quite socially isolated or disconnected. In this regard, we find out in Singapore, based on our sample, about 6% of older people are socially disconnected. I would like to see that this might not be representing the national situation because this is only a sample. But this number is kind of, giving us some clue about, social isolation or social disconnection is not that high. But if you really want to understand how these people are coming from, we find among the 6%, only 14% are solo livers. About 80% coming from people living with their spouse and children. And that is to say the majority of people with social disconnection issues actually come from families with a lot of family members. That is, even though people are living together, they could still feel socially disconnected or socially isolated. But we also do another examination to see, does living alone matter to be a risk factor or not? And the results show it is very obvious solo livers are more likely to be socially disconnected. Therefore, the full story should be described like this. Number one, solo living is a risk factor. However, the majority of socially disconnected people come from those who are not living alone. These two conclusions are not contradictory together. And such a pattern reminds us that, yes, we need to pay attention to solo livers at older ages. However, a big chunk of socially disconnected older people probably are from people living with family members. And we recently did, we actually also did some further investigations. We find out for the solo livers, particularly men, uneducated, they are more disadvantaged in terms of social disconnection. And in this regard, in this paper, those of you who are interested in the finding of this paper, you will see the major implication of our finding is, we think community-based interventions, to help with people socially disconnected. Probably we should expand the scope beyond the solo livers, because the majority are indeed coming from those living with family, particularly men, and particularly particularly those with poor health and without formal education, even though they are living with family. If they are with poor health and without formal education, they are more likely to feel socially disconnected. On the other hand, solo living is still a risk factor. And within solo livers, men are more likely to be socially disconnected than women. So that's the basic pattern. We recently go deeper. This is unpublished. We are still doing research on this. This is a new project. The PI is Professor Rasi Mahadrin from AUS Medicine. We further investigate another community in Singapore. This time we have about 924 people. Among the 924, we have about 14% live alone without any family members. And interestingly, those 14%, about 127 people, we find about half of them never married. And that gave us more clue to see what's really going on about the solo livers within Singapore. The results are quite interesting. If we compare those solo livers who never get married and solo livers who ever married but probably now widowed now, and we separate these two groups and then compare with those people living with family members, the pattern are very interesting. You can see actually people live alone but never married, they are actually the happiest. They have less psychological loss, and their score of psychological growth is also the highest, and they feel less socially isolated. So what does that mean? That means we cannot understand solo livers as a homogeneous group. At least in Singapore, there's at least a half of solo livers in Singapore are probably super active, super happy, even higher than those living with family. They never married, and they have been adapted to the solo living life and become very socially active in later ages. And that gives us more evidence to show we cannot assume solo living as simply a negative thing. With policies wise, probably we need to go further to check more details about solo livers. And obviously, there's a super happy group there. Okay. This research is not done yet. We are going to report our formal study later. Now let's move to another interesting question. Is social support promoting health? Yes. Actually, this has been long established in the literature. Social support has been found out to provide a lot of benefit to promote health and well-being. This is not only applicable to the older ages, but actually also for young people and adults. On the other side, according to the health selection theory, people with poor health probably they cannot maintain their social relationship. Therefore, on the other side, poor health is related to less social support. Anyway, either more social support related to better health or poor health related to poor social support. That these two theories all suggest social support is positively related to health and well-being. However, we all know that social support is often reorganized in a later life, particularly in Asian societies. Namely, when people have health issues, they may choose to change their living arrangement, and therefore they could access to better social support. That's the Asian value, namely, older people, our families really would like to provide better support when their health is declining. That actually suggests social support should be negatively related to health. But how come in the social survey, we always find a positive relationship? This is against the social expectation. We're actually holding this puzzle and to try to resolve this puzzle. We run the data from SCHS. It's quite obvious that either the total support, family support, non-family support, you can see all negative. Namely, as long as your health is worse, then your support is worse. So poor disability, cognitive impairment, depression, all lead to the decline of social support. And people say, I have poor or fair health in contrast to good health. These people will also have less social support. This is, when I find this, I was very surprised, because I think in Asian society, older people, when they have poor health, they are actually supposed to have better social support instead of worse or less social support. This is actually quite ironic to me. How can we resolve this puzzle? We have to use the same Duke social support skill to see what's really going on with the skill. This is a West culture-based skill. In that culture, family may not play a kind of first line of support. And people in later life would like to be more independent. And based on this skill, we find the skill actually could help us to identify 4 types of social support patterns. Some people are actually receiving support from everywhere. However, some older people only receive support from family members. What is really going on here? We then run analysis. We find, indeed, when people have worse health, their social support will be shrinked within family. That perfectly in line with our expectations. That is, when older Singaporeans feel sick, disabled, they are going back to their family members. They are losing social support from the society, but they are receiving more intensive social support within family. And therefore, on the surface, we can see this kind of negative sign, namely your health is less, then your social support reduce. This kind of reduce actually is the reduction in the scope of social support, but not in the reduction of intensity or amount. That is a reason that is the reason we see this kind of ironic pattern. We find that while Singaporeans in poor health have lower social support, they are actually more likely to receive support from children. That indicates behind the reduction of social support scores, there's a reorganization of social support resources within the family. This is very typical for Asian societies, which result in the reduction in scope, but increase in intensity and amount. That explains the puzzle. And also, this suggests whenever we do research in Singapore, we should be quite careful. I have this kind of experience to directly use the Western-based protocols to study Singapore society. I suggest that as the practitioners, researchers, we should be very careful in using those established protocols from non-Singapore background. Unlike Western populations that promote individual responsibility and strong state systems, Asian societies often hold very strong familialism in response to older care. Therefore, directly adopt the social support skill from the West could be quite limited methodologically and therefore produce quite ironical patterns against the general expectations. And not only that, I would like to further add some point. As we all know that this kind of skill, as you can see, is not considering the specific social support context of Singapore. For example, the maid has never been mentioned in this skill. And as we know that the maid per capita in Singapore is the highest around the world, and as a major role in elderly caring, ignoring the role of maid could be a big limitation of this skill one applied to the Singapore context. So that's my these are the two basic studies. Thank you very much for your listening. So basically, I have been reviewing two Singapore-based studies to address issues related to living arrangement and social support. In these investigations, we find out, number one, solo living should not be naturally, spontaneously considered as disadvantaged. Number two, social support should not be considered that spontaneously positively related to health. And these two issues probably has been adopted in our practical work. And our research actually shines some new light to give you some reflections about it. Thank you very much. Yeah.
Thank you, Prof. Fang, for your presentation. So now, before I hand over the time to Dr. Art Malot for the Q&A with the audience, just a gentle reminder that you can ask questions in two ways. First is using the Poll Everywhere link that we have shared in the Zoom chat. Alternatively, if you wish to speak up and ask your questions directly, please use the virtual raise hand function under reactions. And yeah, wait for moderator to call you before you unmute your microphone and turn on your camera to ask questions. Yeah, so I will now allow audience to speak. Yeah, okay, thank you.
So do I take over from here, Zihan? Yeah. So I've been told that the audience at SSR tend to be shy. And I certainly hope that this Q&A session will not be a private discussion session between myself and Prof. Feng. But before we start, maybe let me kind of wrap up the very interesting presentation that you just gave, Feng Chushi. Thank you so much for that. And what I learned from the presentation is basically 4 key assumptions that we should not take for granted moving forward when we deal with older persons in Singapore. Assumption number 1, which is living alone does not equate to being socially isolated. Number 2, we need to debunk the assumption that those who live alone are a sad, gloomy, pathetic bunch. Apparently from the findings, they are actually the happiest lot amongst the rest, those who are never married. Yeah, there's a difference between those who are never married and those who are married. The third assumption is that poorer health triggers increased support. And that's not true. Actually, being in poorer health means that you perceive lesser support from others. So what's going on there? And the last assumption, and this is something that I would add to the presentation, is that provision of support does not guarantee that needs are met. So these are the assumptions that needs to be unpacked and outlined. And we have a question from Paul. Go ahead. Paul, are you there?
Paul, you can ask directly. You are muted now.
Okay. In the meantime, maybe Paul is having some technical difficulties. If you do and are having technical difficulties, you can approach any of the SSR members and explain to them what's going on. So before we begin talking about this connection, Chushi, I call you Chushi, okay?
Yeah, sure.
I thought we should start with understanding what connection means. I mean, loosely, the definition of connection means the feeling we get when we feel known, seen, understood, valued, remembered, and cared for. And therefore, being or feeling disconnected then implies the absence of those experiences. Here, I would like to emphasize the word feeling because as your presentation highlighted, the people who felt disconnected actually live with other people and are surrounded by other people. So it's not that they do not have anyone around them. It's not that they are not supported by anyone around them. It's that they feel that they are not getting the support that they need. So first of all, like what, in your opinion, in your experience dealing with research in aging, what types of support, are usually expected from older persons?
That's a great question. Actually, it's a very essential one to how can we improve the elderly care system. There's different kind of support, as you mentioned. For the older people, probably many people, put financial support at the basic, support, basic format of support. Older people need financial support to make a living. And beyond financial support, when people have functional limitations, probably instrumental support will become very important. And after that, there's emotional support. Actually, across Asia, older people's needs of social support are very much stratified by different social strata. For a lot of older people, if they are living in a quite middle class living standard, probably the financial support and instrumental support are less valued, but they might more seek, the companion and emotional support from children. And but unfortunately, many of those children are kind of working busy and no time to accompany their parents. I sometimes feel that's a problem in Singapore in terms of how to better taking care of parents. Namely, many parents may not need the money, but they need the company. But on the other side, I do think there's a certain percentage of older people may need more financial support. And that's also actually make a call for more of the public interventions to help older people to have enough financial resources. And also older people also need the young children's financial support. So I think we really need to separate these two domains because the issues are very complicated. Yeah. Sorry, Malot, you are muted. Yeah.
Oh, sorry. Yep. I think your presentation, you do use the terms disconnection and isolation interchangeably. Do you see these effects as interchangeable? Are they the same?
That's yeah. Thank you for the question. They are not the same. We are not supposed to use this in such a way. Academically, social disconnectedness, social isolation, social exclusion, all kind of terms in general related to social capital, social network, and social relationship. There's a lot of debate about how to conceptualize and operationalize it. We did not follow certain type of the definition here, but simply use the Duke social support skill to make up index of social disconnectedness. So that could be our limitation. But on the other side, I think like even though we adopt another side of measurement, we might also reach the same conclusion, namely most of the depressed, isolated people, majority of them should come from families who are living together rather than solo livers. Yeah.
So I think for the purpose of this Q&A, I'll just focus on the term disconnection because that's the focus of the papers, the two papers that you're drawing your findings from. And I think there's a question from an audience, right? Why is the study of disconnection important? And what's the effect of disconnection on older people mentally and physically?
I think that's an important issue researchers have been investigating for a very long time. Like social connection is one of the major indicators of life quality in later life. Let me raise the most evident empirical findings. That is the widowhood effect. The most important social connection in older age is widowhood, is a spouse, and therefore losing spouse will be the most disastrous event for older people, and that's also the reason that across all the nations, people always find out that after the widowhood and older people's mortality increased very significantly. So that's the very basic pattern. Basically, going back to the point, later life connections is highly related to social connection. Beyond spouse, friends play a bigger role, and people always find out social, making friends will make your later life happier, and not only the emotional side but also the cognitive side. People find out social relationship help to prevent dementia, slow the aging progress, and also positively related to less disability. So in Chinese, there are three terms I always would like to use. In your older age, you need to have 老本, 老伴和老友. 老本 is the money. 老伴 is the spouse. 老友 is the old friends. These three things are very crucial for older life. Yeah.
Thank you for that. Thanks for that response. So Paul had a question just now, and I think in your presentations, you basically highlight certain recommendations that.
Yeah, can you hear me now?
Yeah. So Paul, would you like to ask the question yourself? Go ahead. Go ahead.
Yeah, thanks. Sorry, I was having trouble with my Zoom. I think my question, though, is Singapore is in a pretty unique situation in which we've had a rapid transformation from extended families living in kampongs or large communal settings to atomized kind of houses in flats. So would you be able to see any difference in terms of disconnection, say, between the 60-year-olds versus the 90-year-olds, or you know, with a self-control group in that sense? Over.
You are very right, Paul. Singapore's people sometimes call it expressed modernity, like with a very short period of time, Singapore has been industrialized and modernized. And also, the demographic transition in Singapore is very rapid. It's very rapid. The older generation, the pioneer generation, the Merdeka generation, has been experienced a very different life situation in their adulthood than the current generation. I think that's a very big challenge for Singaporeans. For my own research, I would like to say probably one of the major problem is the digital gap. Because you can easily imagine that the current generation, when they are aging in the next 30 years, they will have no problem in using iPhone, iPad. They were born in an area that they know how to use computers. But the current pioneer generation and Merdeka generation, they don't have such a life course, historical context to learn, and that's why during the COVID-19 and not knowing how to use computers or cell phones may create a lot of troubles for them. And I think that's one of the major problem in terms of the generation difference. On the other side, I would like to, this is my own opinion. I think because Paul is interested in the intergenerational experience, this is my own experience, which has not a lot of data support. I think the low fertility of the current young generation probably may translate to some negative impact to the value system of Singapore. So my argument is like this, because Malot is also an anthropologist. I mean, I would like to think in an anthropological way. Usually, the older generation, they are maintaining a large family. These older people usually have a lot of childbearing experience and taking care of the large family, multiple children. And therefore, filial piety for them is really experienced. They know what is it. They know like how they take care of their children. But on the other side, their children now grown up and with lower fertility, without the childbearing experience. I mean, if you do not give birth to a baby, how could you understand exactly the same as your parents about how much your parents has been doing for you? So they actually, if you do not have a baby, you lose such a field work to experience the childbearing experience. And on the other side, that may translate to the mutual understanding, like how shall I appreciate, my parents' contribution to me. So this kind of logic, I think low fertility may not only mean like Singapore have less people in the workforce, but I feel like it might have a kind of some significant impact on the intergenerational relationship in the future. So but again, this is a personal opinion lah. Yeah, and I hope we can do research on it. I also hope like Dr. Malot could, help us to understand this. Yeah.
I think basically in my line of research, especially being in aging for the past 7 years, there's a lot of emphasis in our government, among social service agencies, to basically see family as the first line of support. And your research, Jushi, shows that family, like basically being with one of your papers showed that being with the family actually restricts older persons from having access to support outside of the family, and that affects, well-being at some point. Can you comment more on that? Like, what is the implication for a family, for a society like us, which emphasizes familialism as the way to go for support?
Oh yeah, that's very accurate actually. What I'm trying to say is living together with family is good, but may not be necessarily good, because that truly depends on the quality of relationship. If you are living with a family full of anger, and then children just assume like, I live with you, how come you can feel lonely? That is a very irresponsible, because family relationship is a natural thing. You need to maintain it, make it positive. One of my recent research is about eating together as a family. Living in Singapore for 10 years, I do feel like adult children may not have enough time eating with their older parents. And that could be, eating is a very social and meaningful activity for older people and for family to get together. And it's quite unfortunate if people are less and less eat together as a family. So basically, going back to the point, family living together is simply a structure. And how, family members interact is the important matter. So we still need to make actual effort, to make people happier and healthier, even though they are living with family members. Yeah.
I'm also wondering why should we focus our interventions, and that's one of the recommendations that you make, focusing interventions on actually older persons living with family members, rather than, for example, placing too much emphasis on solo livers. Like, I'm thinking, why can't interventions, rather than focusing on the family, be in the community? Because families are shrinking and the profile of people living alone are going to expand. So why not focus interventions in the community? And second question, if it takes place in the community, and I think some members of the audience have the same question too, what sorts of intervention would be useful, appropriate, and helpful?
Oh, sorry, this is a little bit beyond my expertise. I think my major point as a in terms of intervention, we have to say, please do not only focus on solo livers, because the majority may come from the people co-residing with family members. And so we are suggesting not to forget about those who are living with family members, because even though they are living with family members, they are still having the risk to be socially isolated. And with that regard, we find being a man, we find out uneducated people and people with poor health, with instrumental disability, are more likely to feel socially disconnected, even though they are living with their family member. In that regard, I think communication and better communication between children and parents should be necessary. But for specific interventions, I'm sorry, this is beyond my capacity. I mean, our finding are not for the practitioner level. So we are relying on those of you who are doing social work to design better programs. Yeah.
I think to answer the question that has been given by an audience about why older men are at risk, I'm an anthropologist, so the work that I do is that, we talk to older persons on the ground and we conduct in-depth interviews. And we've just completed a 2-year study on loneliness amongst older persons in Singapore. So what we found is that older men are at risk of loneliness because they spend all their lives working, and I think that's mentioned in your paper as well. And when they finally reach retirement, they have no idea what to do with their lives. They are used to being in a family dynamic where they are the boss, they run the show, and they are the provider of the family financially. And then suddenly you find yourself not providing for the family financially. And then you realize that you're now on the same par as your wife, who is the homemaker, except that she has had that role to play for ages, and she has had many friends because of her time not working. And you find, and older men find themselves like shrinking out or basically not having a space to call their own within the household. And I think that's why you're recommending that interventions should be made appropriate to support older men. And the interventions for older men does not look the same as interventions
I
for
agree with
older
you.
women. Yeah. So I think one of the key things from your presentation is to basically pay attention to the diversity of older persons, including the types of families that they have, the kinds of living arrangements that they have, because it will likely impact, whether or not interventions work for them.
Yeah, I agree. Yeah.
I think there's also a question on why did you choose the Duke social support scale and not the UCLA loneliness scale? Yeah.
This is not my choice. Usually, to be honest, usually the interdisciplinary cooperation is very hard to happen. So I'm from sociology, and the data set come from US medicine. And we are trying very hard because aging is supposed to be a multidisciplinary subject. So I happen to be a friend of Professor Bowen Pei, and therefore I access to the data set and find out that this skill. But I do, again, going back to the measurement issue, I do think for Singapore-based study, it is a quite significant issue to use the Singapore-based measurement rather than take the established protocol from the West. One of my previous study about the local societies about successful aging, which is a quite important term for Singapore. And we also have, different research using the Western-based successful aging to see how many Singaporeans meet that criteria. But one of the problem of that kind of, index or measurement is that it's always a highlight on the independence of older people. Namely, I don't need any help. But we all know that, having children taking care of me is actually a desirable thing for older Singaporeans. So in our study, we find about 95% of people who wanted to be independent, but on the other side, about 70% of them at the same time say they need to be dependent on children. 90%, 70%, so that means at least 60% of people say, I need to be both independent and dependent. So that is a kind of the very interesting culture saying, namely, older Singaporeans do not want to be the burden of family. They want to be independent, but they expect family members to take care of them whenever needed. Okay, so going back to the point, if you use the Western index, sometimes we cannot capture the local the culture component. Yeah, that's the lesson. Yeah, thank you.
I think there are a few questions among the audience also about whether or not, it's important to, like, how do I put it? Like, problematize this Western, Eastern, Western Asian binary. How do we avoid, like, binary thinking, like the assumption, for example, that the West is individualistic and then the Asian society or Eastern Asian societies are familial in nature? How do we problematize this, like, in terms of our findings as well, and in terms of our assumptions as researchers doing on aging?
I fully understand. I totally agree. The use of the West is a conventional way of approaching this. Within West, there's a great heterogeneities. It could be American, British, Europe, Eastern Europe. There are a lot of different versions of how to perceive about aging and social support. At the same, East, we say Asian value, also vary greatly within. I fully appreciate that. I think one way we're doing this is at least to realize the insignificance of cultural specificity in doing research, particularly in the field of aging, which is very culturally embedded. And therefore, we should intentionally avoid using the foreign-based research tools in our study. The reality is most of the protocols measurement in medicine, gerontology, sociology are not created specifically for Singapore. And that's why such awareness is valuable, to be careful to say we need a local version of the measurement. But of course, I agree, we should not simplify this as a contrast between East and West. It's not as simple like that. Yeah.
Yeah, I agree with you. I mean, I'm also trying to make sense of the responses from the older persons I interviewed when they say things like, I would like to be independent. I do not want to be a burden on my family. And I wonder, I mean, you were saying how in the West there's this sense of independence, individuality as important. And looking forward, in our own community, with globalization and the global flows of ideas and cultures, how would the situation change for us in the future?
Sorry, can you say the question?
As a sociologist, yeah, there's this whole notion of, like, this idea of needing to be independent, needing to be self-reliant, is actually a very neoliberal concept that's being internalized by societies in our shared vision, etc. And even amongst the older persons I interviewed, this desire to be independent. And that, for me, right, based on my research, actually affects how people seek support. And that's a very structural thing. But as you mentioned, that there's structure and there's also agency. So with a very strong, like, social cultural structure that basically promotes independence and active aging, I feel that there bears repercussions on how older persons can articulate the need for support. Maybe you can comment on this based on your research or experiences.
That's actually about the future. So currently, actually, there's still a very strong cultural norm in favor of family. In our investigation in Singapore, a majority of people still prefer to live within family, receive care from children. And they think like receiving care from children is natural, normal, and preferable. But you are very right. In the near future, family will be even smaller. And even though people prefer care from children, they may not have children, or their children may not live with them. That's a big challenge. I mean, it's not about the preference of older people. It's about the structure, population, changes. We also see a lot of new trends. For example, institutionalization. And usually people really do not want to go to institutions because age in place demands them to live within family, within the community. But as we observe in Singapore, China, and many other Asian societies, institutionalization ratio is increasing very rapidly everywhere. So what will be the future? What will be the future? I think is on the one hand, is not the fertility trend looks like hard to reverse back to 2.1. So human beings may never got a replacement level for that. On the other side, more and more older people will live to very old age. And it seems sometimes unavoidable. They are going to having diseases and their dying procedure will be prolonged. My recent research project will be focusing on the growth of death numbers in Singapore and China, because in terms of the population structure, more and more older people may die, at older age, and the sheer number of deaths may increase annually. This is already happening in Japan, Sweden, those super aged society. Yeah.
Thanks for the response. Yeah, I was also thinking about, the whole dynamic that older persons prefer care from family versus friends. In my own research as well, older persons mentioned that they need support from friends in terms of being happy. And therefore, when you are suffering from poor health, depression, you don't have the desire to meet up with friends or ask friends for support because you don't want to be the one that kills the vibe. That was mentioned in several of our interviews. What I was also concerned about is that, and I see it changing in my own research when I interviewed the more middle class, the more educated, older persons, that they are saying something different. They're saying something like, I want my children to care for me, but only in terms of companionship. I do not want my children to be the one offering instrumental support, like basically the one showering them, bathing them. For these types of support, they would like services available for them. So even in the family also, there is different types of support that people see makes them feel connected to others. So again, this attention to understanding, what types of support are perceived as, satisfactory by older persons, and what types of support are basically seen as not in line with expectations. So which is why I see in your research, children are there to provide support. But I think if you're providing support in terms of care, especially if you're poorer health, it may not basically align with expectations for more companion or emotional support that one can get from friends. And I think this is very important for like practice and clinicians as well to think about the different types of support that an older person needs and how they can be met in the community, in the hospital, at institutions, and also in the family. I think we're approaching almost the end of the Q&A. There are a few questions on basically, maybe I'll just point out others. Someone mentioned about this notion of a social emotional selectivity theory, which proposes that older persons become more selective and pursue only activities and relationships that are meaningful to them as they grow older. How does this gel with the observations of your study? Are people more selective? That's why they are more, that's why they reported less satisfied with their support, or what? Yeah.
This is actually some of my ongoing research. The selective of being more adaptive or being more selective in their later life is definitely a very good strategy of later life. In gerontology, there are three line of argument. One group of argument actually believe that people should be as active as possible in older age. And even though in older age, they are not young anymore, they should maintain the same level of activity. Another line of argument saying people should continue their old habit, just like their younger age. And the third group of argument believe that older people should withdraw from social life and enjoy something unique to older age. These are three kind of choice. There's a lot of literature about it. And I think they are also related to the so-called selection theory. Our current ongoing research is investigating, how Singaporeans think about it. And we basically find out that there's a great variation among Singaporeans' preference, which is highly related to their social economic status. Yeah. I hope in the future we could have chance to report our findings. Yeah.
Thank you so much, Prof. Feng, for your presentation. And I think since most of the questions are answered or elaborated, I think we can conclude the session. I will hand this over now to Zhihan. Thank you.
Thank you so much, Dr. Malot, for moderating the session and sharing some of your insights as well as Prof. Feng for presenting your research, although you are on holiday. So thank you so much. I'll quickly launch the feedback poll for the audience. Yeah, please let us know what you think of today's webinar. And I have one last slide to share. Yeah, so just want to highlight the upcoming seminar lineups for the next 3 months from SSR. So if you're not already on our mailing list, please do scan the QR code on the screen to join to receive regular updates on our upcoming events as well as training workshops. Yeah, so with that, thank you so much everyone for joining us today. And yeah, we have come to the end of our webinar. Yeah, thank you so much, Prof. Feng and Dr. Malot. Yeah, please feel free to leave the room. I'll just stay here for a while. Yeah, for the audience to finish the poll. Yeah, thank you.